What if I told you there is one critical mistake that an astonishing 90% of people living with hypertension are making? A mistake so insidious, so subtle, that they don't even realize they're doing it. They genuinely believe they have everything under control, taking their medication diligently and monitoring their blood pressure readings now and then. But the harsh reality is that every single day they are walking on dangerously thin ice, beneath which lurks the looming threat of a stroke or a heart attack. This mistake isn't just one isolated action. It's an entire counterproductive mindset that transforms genuine medical treatment into nothing more than self-deception. Today, we won't be discussing the usual, obvious platitudes. We are going to expose the psychology behind this error, dissecting it into its core components. And I promise you, by the end of this presentation, you will look at your hypertension through entirely new eyes. Are you absolutely certain you are not one of those 9 out of 10? Let's find out. Stay with us, because the knowledge you gain today could genuinely save your life. Before we delve into the heart of the problem, let's establish a crucial foundational understanding. Imagine a car tyre. It needs a specific internal pressure to ensure the vehicle drives smoothly and safely. If the pressure is too low, that's certainly problematic. But if the pressure is too high, the tyre becomes rigid, loses its road grip, and hitting even a small obstacle could cause it to blow out. Your blood vessels are essentially those tyres. Your blood is the air inside. Hypertension is the chronic state where your tyres are perpetually overinflated. Your heart, which acts as the pump or the compressor, is forced to work under monstrous strain just to push blood through these tense, pressurized vessels. And the most frightening aspect is that this entire destructive process of internal wear and tear, affecting both the heart muscle and the blood vessels, is completely silent. You could be driving on those overinflated tyres for years without noticing any real physical problem until one day the system suffers a catastrophic failure. Understanding this simple mechanical analogy is the key to grasping the sheer seriousness of the situation we are about to discuss. So the first component of this crucial mistake we often make is falling into the trap of the illusion of well-being. We live by the belief that, as long as I feel fine, everything must be fine. This is perhaps the most dangerous misconception we can hold. High blood pressure isn't like an acute pain that forces you to rush straight to the doctor. It is a slow, silent corrosion. It's the definition of the silent killer. Now picture a huge steel bridge. It might look absolutely solid and completely reliable on the surface, but underneath it's been quietly rusting from the inside for decades. Cars drive across it, people walk over it, and nobody suspects the hidden danger. But then, one dreadful day, the main supporting structures finally fail, and the whole thing collapses. High blood pressure works exactly the same way. For years, often without a single symptom, it slowly erodes your blood vessels, making them brittle, and forces your heart to work itself into exhaustion. When those first real warning signs finally appear, the persistent headaches, the shortness of breath, the dizziness, that is not the beginning of the illness. That is the signal that your bridge is already severely compromised and is standing right on the edge of collapse. When dealing with hypertension, relying solely on how you feel is exactly the same as deliberately ignoring a ticking bomb just because you can't actually see it yet. The next step down that slippery slope is what I call playing medical Russian roulette. The thought process often goes, I feel perfectly fine, my blood pressure reading is normal today, so I'll just skip a dose. I need a break from all these chemicals. This reveals a catastrophic misunderstanding of how modern hypertension medication actually works. A blood pressure tablet is not a painkiller you take only when you feel bad. It's your personal, constant regulator, designed to maintain a safe, steady level within your circulatory system. By skipping a dose, you're effectively switching that regulator off. Your pressure, now left unchecked, begins to spike and drop wildly. These sudden shifts, these cardiovascular roller coasters, are actually far more damaging than pressure that is consistently high. Every single one of these rapid changes is a powerful blow against the walls of your arteries. It creates tiny tears, encourages the formation of dangerous blood clots, and drastically raises the risk of a stroke or a heart attack. You may not feel these swings, but your body definitely registers them. Every missed dose is like pulling the pin out of a hand grenade and gambling that it won't go off. A normal blood pressure reading while you're on medication is not a license to stop taking it. It is concrete proof that your treatment is working exactly as intended and must be continued. The third piece of self-deception we need to address is believing in the magic power of nature. Why poison myself with pills when I can just take garlic, rosehip tea, or simple herbs? This is the thinking process of a patient who swaps proven, evidence-based medicine for old wives' tales. Let's be honest. Nobody denies that these natural products are beneficial. They are full of vitamins and antioxidants, and that's great. But trying to treat a serious condition like high blood pressure with them is like trying to plug a massive breach in a dam with a single leaf. Hypertension isn't a minor complaint. It is a serious malfunction deep within the body's complex regulatory system. Modern medications are specifically designed to target the exact mechanisms causing this breakdown. They widen your blood vessels, reduce the strain on your heart, and get rid of excess fluid. Their effectiveness isn't guesswork. It's proven through thousands of rigorous studies. Now, what does a cup of herbal tea actually do? It might offer a mild diuretic or calming effect. That can be useful, yes, but compared to the severity of the underlying disease, it is nothing more than a drop in the ocean. By relying solely on folk remedies, you are wasting the most valuable resource you have: time. While you are sipping on those infusions, the disease is actively progressing, silently causing irreversible damage to your vital organs. Natural remedies can sometimes be a tiny supplement to your main treatment, but they must never, ever be used as a replacement. Self-adjusting your dosage, that's what we call playing doctor, is another risky move entirely. The thinking behind it might seem simple, but it can be utterly destructive. Maybe you think, the GP prescribed 10 milligrams, but my blood pressure isn't actually that high today, so I'll just take 5, just to be on the safe side. Or perhaps the opposite happens. My pressure's shot up. I'll take 2 pills right away, just to make sure it comes down fast. Both scenarios are massive mistakes. Your medication dosage isn't some random number chosen out of thin air. Your doctor carefully selects it, factoring in dozens of parameters. Their goal is to create what's known as the therapeutic window in your bloodstream, the perfect concentration of the drug that works effectively without causing nasty side effects. If you reduce the dose, you drop right out of the bottom of that window. The drug stops working properly, leaving you completely unprotected, even though you still believe you're treating yourself. Increase the dose, and you smash through the top of the window. This can cause your pressure to drop sharply and uncontrollably, leading to dizzy spells, severe weakness, and crucially, disrupting blood flow to the brain, potentially triggering an ischemic stroke. Any change or correction to your treatment plan is strictly the doctor's call. It's their prerogative, not yours. Your job is simply to stick precisely to the prescription, not run risky experiments on your own body. My friend is doing so well on this medication, so I think I'll give it a try. This idea of borrowing a pill is simply a recipe for disaster. Blood pressure medications are not like a general-purpose multivitamin. They are highly specialized tools, and for every lock, that is, every patient, you need your own unique key. The causes of high blood pressure or hypertension vary greatly. For one person, it might be due to fluid retention. For another, overly tight blood vessels. And for a third, an overactive nervous system. We use different classes of drugs, and each one targets a specific mechanism. What worked wonders for your friend might simply not work for you, because the root cause of your hypertension is different, but that's the best case scenario. The worst case is that taking a borrowed tablet could be outright dangerous for you due to an underlying health condition you might not even be aware of. For instance, some very common blood pressure medications must not be taken if you suffer from conditions like gout or asthma. Taking medicine based on the advice of a non-expert means you are acting completely blindly. You risk not only getting no benefit, but actually doing serious harm to your health. Choosing the right treatment is solely your doctor's individual professional job, not a group decision. So many of us fall into the trap of believing in the magic bullet pill. We genuinely think that taking that tiny daily tablet is a cure-all, a perfect solution that will simply fix every problem. Yet we continue to eat takeaways and processed food, perhaps 40 or 50 pounds overweight. We keep smoking and lead a completely sedentary life. This is exactly like trying to empty a swimming pool using a small cup, without ever bothering to turn off the tap that is constantly pouring water back in. The medication certainly helps. It is the one bailing out the water. But your lifestyle, that is the running tap, flooding the pool non-stop. Every pinch of salt you consume, every extra pound you carry, acts as a huge strain on your heart and circulation. The medication is forced to fight not just the original illness, but also the constant consequences of your choices. Eventually, it just can't keep up. Its effectiveness runs out, and your blood pressure will inevitably spiral out of control again. Changing your lifestyle is not simply a desirable addition. It is the absolute foundation of everything. Losing weight, cutting out salt and cigarettes, and getting adequate exercise are incredibly powerful therapeutic tools. They often work far more effectively than any tablet. Only when you properly close that tap will you give your medication a genuine chance to do its job properly. My blood pressure usually sits at 150/95, and I feel absolutely fine with it. This myth of a personal normal blood pressure is one of the most dangerous beliefs out there. Please understand this once and for all. There is no such thing in medicine as working pressure. There is a healthy standard, anything below 140/90. And there is illness, anything above that. Full stop. Your body can indeed adapt to these persistently high readings. Over time, those initial headaches might fade, and you start to think everything is under control. But this adaptation is purely an illusion. While you are getting used to it, your vital target organs, the brain, the heart, and the kidneys, continue to function in a state of extreme damaging overload. They cannot get accustomed to this strain. They are simply being slowly destroyed. Think of it like living in a house where the alarm is constantly blaring. After a week, you stop noticing the noise, but the reason the alarm went off, perhaps a gas leak, hasn't gone away and will eventually lead to disaster. The goal of treatment is not to simply adapt to the condition, but to bring your readings back down to a safe, healthy level to stop that destructive process entirely. Any reading above the standard norm is not your own personal idiosyncrasy. It is quite simply a ticking time bomb. A lot of patients see monitoring their blood pressure as optional, a nice to have, rather than a must have. They might think, if I remember to measure it, great. If I don't, no big deal. But that's essentially flying a plane completely blind, basing critical decisions only on how you feel at that moment. For your doctor to prescribe truly effective treatment, they need a complete picture, the full flight path, if you will. That means objective data showing exactly how your pressure behaves throughout the day, and only you can provide this map by consistently keeping a monitoring diary. This is, without a doubt, your most crucial input into the treatment plan. Record your readings first thing in the morning, before you take your medication, and again in the evening right before bed. Always log your pulse rate and make a note of any unusual symptoms or events you experience. This diary acts as a decoder for your physician. It reveals hidden pressure spikes, helps them assess how long your medication truly lasts, and identifies why your current therapy might not be working as expected. Without this comprehensive data, the doctor is forced to make major decisions based solely on the single reading taken in their surgery, a reading which is often skewed by stress, what we call white coat syndrome. Keeping a logbook transforms you from a passive patient into an active, crucial partner in your care, significantly boosting your chances of success. You stop flying blind. On the flip side, we have what's often called the panic pill reflex. Say you check your monitor, see a reading like 170/100, and instantly panic. Your first thought is to grab an extra pill just to get those numbers down fast. This kind of knee-jerk impulsive reaction usually does more harm than good. A single spike in your blood pressure, especially if you've been stressed or physically active, is not a reason to panic. It's often just a normal physiological response. Instead of reaching for the pill bottle, the sensible thing is to just sit down, calm yourself, take 10 or 15 minutes for deep breathing, and then recheck the reading. Often, the pressure settles down all by itself. Taking extra medication without control can cause your pressure to crash dramatically, which is far more dangerous than the temporary high. That rapid drop can lead to severe weakness, fainting, and even serious problems with blood flow to the brain. The goal isn't to zap every little rise in pressure, but to manage your hypertension systematically using the maintenance medication your doctor prescribed. Taking extra emergency medication or calling for an ambulance is only truly justified during a full-blown hypertensive crisis. That's when extremely high numbers are accompanied by truly worrying symptoms, such as an excruciating headache, sharp pain behind the breastbone, or severe neurological issues. I'll just take these tablets for a month, my blood pressure will settle down, and then I'll be sorted. This misconception, this idea of a finish line, stems from a fundamental misunderstanding of how the condition actually works. Hypertension, or high blood pressure, isn't like a common cold that you can simply cure with a course of antibiotics. In the vast majority of cases, it is a chronic condition, a lifelong companion, if you will. It cannot be cured, it can only be managed and controlled. Think of it this way. Suppose you have poor eyesight. You wouldn't wear your spectacles for a month and then toss them aside, hoping your vision has magically fixed itself, would you? You wear them constantly so that you can see properly. It's exactly the same principle with your blood pressure medication. You take them not to get cured, but rather to consistently maintain your pressure at a safe, healthy level so you can enjoy a full life. The moment you stop taking them, the condition hasn't vanished. The mechanisms that cause your pressure to rise simply reactivate, and everything reverts back to where it started. Treating hypertension isn't a short sprint, it's a lifelong marathon. Accepting this fact is the crucial step that separates successful long-term management from constant relapses and complications. When folks run into a little trouble, say that persistent dry cough, or maybe your ankles are swelling up, a lot of patients make a crucial mistake. They immediately think, right, this medication is useless, it's actually harmful, I'm done with it. They just ditch their treatment plan, often without even picking up the phone to talk to their GP. That's like setting off on a vital journey and deciding to turn straight back home the moment you hit the first little bump in the road. That's giving up the fight, isn't it? Now, yes, side effects do crop up, but please, don't let a minor inconvenience convince you to abandon the battle for your own good health. It simply means we need a change of approach. Modern heart medicine, cardiology, has an enormous toolkit. We're talking about dozens of different medications, all working in slightly different ways. If the first one isn't quite right, your doctor can always find an alternative, one that gets the job done without causing you any unpleasant sensations. Taking yourself off the medication is honestly the worst decision you could make. You leave yourself completely exposed to high blood pressure, and let me tell you, that is thousands of times more dangerous than any cough or swollen ankle. Here is the proper way forward. If you feel a side effect, contact your GP immediately, then work together with them to find a suitable replacement drug. Don't let a temporary nuisance strip you of the essential protection you need against strokes and heart attacks. I don't want to get hooked on pills. I'm afraid of becoming dependent. This fear of drug dependency, especially when discussing essential medicines, is a deeply ingrained and totally unfounded myth. Blood pressure tablets are not addictive in the way that recreational drugs or certain tranquilizers are. They do not affect your mind, and they certainly do not cause severe withdrawal symptoms or physical cravings if you stop taking them. Your body doesn't get used to them and suddenly forget how to function on its own. The reality is, Your system is already faulty. That's why you developed high blood pressure in the first place. The medication isn't creating dependence. It's compensating for an existing flaw in your body's regulatory system. Yes, you need to take these medications consistently, likely for life. But this isn't dependency, it's necessity. Think of it this way. A diabetic needs insulin, and someone with hypothyroidism needs thyroid hormones. We call this crucial maintenance therapy, not addiction. To be afraid of relying on medication that actively protects your brain and your heart is an irrational fear. This worry actively hinders proper treatment and puts your long-term health at risk. It's not a crutch, it is a lifeline. Now, when most of us look at our blood pressure monitor, we tend to fixate on that top number, the systolic reading, and the bottom number, the diastolic one. Well, that often gets overlooked. We might think 145 on the top, that's high, but 95 on the bottom, that's close enough to normal. Ignoring that lower figure, however, is a very serious mistake. That number actually reflects the tone and tension of your blood vessels while your heart is resting between beats. If it's consistently elevated, it signals that your arteries aren't fully relaxing. They're in a perpetual state of tension or spasm. It's a sure sign that they are becoming stiff, losing their natural elasticity, and that you might be dealing with progressive atherosclerosis. In fact, for people under the age of 50, a high diastolic pressure can often be an even more ominous predictor of future heart trouble and cardiovascular events than the systolic number is. Ignoring it is essentially like focusing only on your car's speedometer while neglecting the warning light for low oil pressure that's permanently glowing on the dashboard. It's a vital signal of a critical underlying issue in the system itself, one that needs immediate attention. Both readings are crucial, and both must be kept within healthy limits. The old programming maxim, garbage in, garbage out, perfectly sums up what happens when we take our blood pressure incorrectly. If you take your measurements haphazardly, the resulting figures are essentially worthless, and making vital treatment decisions based on false data is quite simply dangerous. To help you get it right, here is a quick checklist of the most common mistakes people make: measuring on the run or without resting for 5 minutes beforehand, talking during the procedure, having your arm in the wrong position, it must be level with your heart, using a cuff that is either too tight or too loose, crossing your legs, measuring over clothing, drinking coffee or smoking less than 30 minutes before you start. Each of these small details can distort your reading by 10, 15, or even 20 points. This means you could end up panicking needlessly over artificially high numbers, or worse, miss a genuine blood pressure spike entirely because you got a falsely normal result. Effective treatment relies on accurate, reliable data. Just dedicate 2 extra minutes to following these simple guidelines, and you will get a truly honest picture of your vascular health. It's a very convenient psychological trick, isn't it? Finding someone else to blame. We say things like, "My blood pressure shot up because of that solar flare today," or "It's all down to the stress I'm under at work." Shifting the blame onto external factors is simply the classic ostrich strategy, burying your head in the sand. Yes, of course, the weather and stress can affect your pressure, but in a healthy person, those fluctuations are usually minor, because their internal regulatory system is working fine and adapts quickly. However, if your blood pressure skyrockets every time you experience stress or the weather changes, it's a definite sign that the system is already broken. These external factors are only catalysts. They simply reveal an existing underlying problem, which is, of course, hypertension itself. By blaming the weather for everything, you are distracting yourself from treating the main condition. You start tilting at windmills, instead of actually fixing the windmill itself. This allows the disease to progress unchecked, hidden neatly behind the convenient excuse of outside circumstances, until it is simply too late. Lots of patients get really focused on the numbers. Their main goal is seeing that magic 120/80 flash up on the blood pressure monitor. Now, achieving that reading is a good short-term tactic, but many people completely miss the strategic point entirely. The true goal of treating high blood pressure isn't just about getting nice numbers on a screen. It's about protecting your vital organs from serious long-term damage. Every single day your blood pressure stays managed. Because you've taken your tablets, you're doing much more than simply feeling all right. That day, you are protecting your brain from the risk of a stroke. You are giving your heart a much-needed rest, preventing strain and the development of heart failure. You are saving your kidneys from damage that could lead to dialysis down the line. And you are protecting the delicate vessels in your eyes from bleeds and potential blindness. Understanding this bigger, global objective changes everything. That daily tablet stops being just a routine chore or a nuisance you have to put up with. It becomes your daily investment in your own future, in years of active, healthy living. You aren't taking it just for the blood pressure monitor, and certainly not just for your doctor. You are taking it for yourself, so you can live a long, full life and maintain your quality of life. The internet is absolutely awash with advertisements for these so-called miracle cures. We see all sorts of things: magnetic bracelets, those famous Tibetan patches, or drops made from rare, exotic herbs. They all promise the world a total cure for high blood pressure in just one course, or a magical cleansing of the arteries. This frantic chase for a magic bullet is a really dangerous gamble. People get fed up with the routine of taking pills every single day, and they are easily taken in by these incredibly sweet promises. They end up throwing away good money, wasting precious time, and, worst of all, eroding their faith in real treatment. By abandoning proven, established therapy in favour of some dubious method, they leave their serious condition completely unchecked. The truth is, not a single one of these miracle cures has passed any serious clinical trials, and they have absolutely no scientifically proven effectiveness. At best, you might get a placebo effect. At worst, it's simply a useless gimmick, or even a harmful cocktail of ingredients. While you're busy trying to clean your arteries with herbal drops, the real damage from high blood pressure and atherosclerosis is continuing unchecked. When it comes to your health, you must only trust treatments that are scientifically vetted and specifically recommended by your own GP. Everything else, quite frankly, is a dangerous game with your own long-term health, and the stakes, my friends, are simply too high. I've been given a prescription for something really expensive, and I simply can't manage the cost. Unfortunately, hitting a financial barrier like this is a very real problem for many of us. And when people face this, some make the worst possible decision. They just stop taking the medication altogether, or they try to economise by only taking half a pill when they should be taking the full dose. Letting your bank account dictate your health is a dangerous path. So, what should you do? The first and most important step is to talk. Be completely honest and upfront with your GP. Tell them straight away that the prescribed therapy is simply out of your price range. Today, nearly every original brand name drug has an equally effective but much more affordable alternative, known as a generic. Your doctor can easily help you find a high-quality, budget-friendly substitute. Secondly, inquire about special support schemes. In many places, patients dealing with cardiovascular issues are entitled to receive life-saving medication free of charge or at a massive discount. Don't be embarrassed to ask your local clinic or dispensary about what financial assistance is available. The money you spend today on managing a condition like high blood pressure is absolutely nothing compared to the colossal expenses required for rehabilitation after a major stroke or the cost of treating severe heart failure. Investing in prevention and keeping up with your medication is, without a doubt, the wisest investment you can make. The mistake of tunnel vision is focusing only on the blood pressure numbers and completely ignoring other, equally important readings. High blood pressure, hypertension, is rarely a lone wolf. It always brings its trusty companions: high levels of bad cholesterol and raised blood sugar. This trio behaves like three accomplices committing a serious crime against your arteries and blood vessels. High pressure damages the artery walls, creating tiny little scratches or lesions. High cholesterol immediately rushes in to plaster over these scratches, starting the formation of those nasty atherosclerotic plaques. And high sugar levels thicken the blood and drastically accelerate the growth of these plaques. Working hand in glove, they multiply your risk of a heart attack or a stroke many times over. That's why controlling only your blood pressure means you're fighting just one of the three criminals. You absolutely must have regular checks for your cholesterol and glucose levels. If they are raised, your doctor will prescribe additional treatments, statins to lower cholesterol, and appropriate medications to manage your blood sugar. Only a comprehensive approach, a decisive strike against all three targets, can ensure your blood vessels have real safety and long-term protection. The final, and arguably the most serious mistake we make, is psychological denial, what I call the not me syndrome. If you feel fit and strong, you simply refuse to believe that a chronic condition could happen to you. We think, oh, that's for older folks, not me. I'm just run down, it's only tiredness. This is really just an unconscious attempt to protect our view of the world, the one where we stay perfectly healthy. But this kind of self-protection is a huge disservice. While you're in denial, you put off seeing the doctor, you ignore those nagging little signs, and you come up with 1,000 excuses not to act. And all the while, the illness isn't waiting around. It's quietly, methodically, working away. Now, accepting a diagnosis isn't a sign of weakness at all. Quite the opposite, it's a tremendous act of courage and strength. It means you are looking the truth right in the eye and taking control of the situation. Admitting there's a problem is the absolute first, crucial step toward fixing it. The sooner you move past denial and start taking action, the better your chances are of leading a long and healthy life, diagnosis notwithstanding. Remember, it's not a life sentence. It's a roadmap for how to proceed. So, what exactly is this critical, even fatal mistake that nearly everyone seems to be making? As you may have realized, it's not just one single thing. It's an entire cascade of poor decisions, faulty thinking, and ingrained habits, all rooted in a foundation of misunderstanding and, frankly, a lack of diligence. It's the tendency to shift the responsibility onto how we happen to feel, onto the weather, or by relying too heavily on old wives' tales or folk remedies. It's the dangerous game of playing chemist or doctor with our own medication. It involves completely ignoring associated risks and refusing to accept the chronic nature of our illness. Every single one of these 20 pitfalls is a step away from the safe path, a step directly towards disaster. But the good news is, now you hold the map. You are fully aware of these traps and dangerous turns, and this knowledge gives you immense power. The power to take complete and conscious control of your own health journey. Remember this, when tackling conditions like high blood pressure, your main ally isn't a pill, it is you. It is your understanding, your discipline, and your personal accountability. Thank you for staying with us right until the end. If this video has shed new light on anything for you, please do give us a like and subscribe to the channel so you don't miss our upcoming essential discussions. Now, a question for you. Which of these discussed mistakes struck you as the most surprising or the least obvious? Please share your thoughts in the comments below. Your feedback is incredibly valuable to this community.